Hello, beautiful souls. I'm Dr. Anna Schneider, and if you're watching this, chances are you're a mama-to-be battling that all too familiar ache in your back. Let me tell you something right now, you are not alone, and you are not powerless. Pregnancy is a miracle, your body is literally building a human, but oh boy, does it throw some curveballs, right? Back pain doesn't have to steal your joy or dim that glow you've got going on. After 15 years of helping patients take charge of their bodies, I'm here to share the secrets that work, no fluff, just science and a whole lot of heart. Picture this, you, standing tall, moving with ease, and feeling proud of the incredible strength inside you. That's what we're aiming for today. So grab a cozy spot, maybe a cup of tea, decaf, of course, mama, and let's dive into how you can relieve that back pain and reclaim your power. Stick with me, because by the end, you'll feel ready to conquer anything. Let's do this together. Alright, my friends, let's get real for a second. Back pain during pregnancy is one of those things that sneaks up on you. One day you're feeling like a goddess, and the next, you're wincing every time you bend to tie your shoes, or let's be honest, attempt to tie them before giving up because, hello, baby bump. I've seen this in countless patients over the years, and I've felt their frustration. But here's the good news, you don't have to just deal with it. You're not a passenger in this journey, you're the driver. And I'm your co-pilot, here to guide you with tools that are practical, safe, and backed by science. So, why does back pain happen during pregnancy? It's not just about the extra weight, though, trust me, carrying around a little human does add some load. Your body is shifting gears in ways you might not even notice. Hormones like relaxin are loosening your joints and ligaments to prep for delivery, amazing, right? But that can make your spine feel a little wobbly. Then there's your posture changing as your belly grows, and those core muscles? They're stretched to the max. It's a perfect storm, but it's not unbeatable. Today, we're going to cover 3 big pillars: understanding what's happening in your body, simple moves to ease the pain, and lifestyle tweaks to keep you strong. I want you to feel empowered, because you are stronger than you think. Ready to take back control? Let's start with the why, because knowledge is your superpower. Now, let's break this down like we're chatting over coffee, except I'll spare you the caffeine lecture for now. As a doctor, I've spent years studying the spine, and pregnancy is like a masterclass in how adaptable our bodies are. But adaptability comes with a price, and for many of you, that's back pain. Let's unpack the culprits so you can see the bigger picture. Hormonal havoc. First up, hormones. When you're pregnant, your body pumps out relaxin, a hormone that's like the unsung hero of childbirth. It softens your ligaments and joints, especially around your pelvis, so your baby can make their grand entrance. Genius, right? But here's the catch, it doesn't just target your pelvis. It loosens things all over, including the ligaments stabilizing your spine. Imagine your spine as a stack of blocks. Normally, those ligaments are like glue keeping it steady. Now, they're a little stretchier, and that can lead to extra strain on your back muscles. Have you noticed your hips feeling a bit looser lately? That's relaxin at work. It's doing its job, but it can leave your lower back saying, "Hey, I need some help here." Don't worry, we'll get to that help soon. The weight game. Next, let's talk about that beautiful bump. By your second trimester, you might be carrying an extra 10, 20, or even 30 pounds, baby, placenta, fluids, the whole crew. That weight pulls your center of gravity forward. To compensate, you might lean back a little, putting pressure on your lower spine. I call this the pregnancy sway. It's natural, but it overworks your lumbar region, that curve in your lower back. Over time, those muscles get tired, tight, and downright cranky. Here's a fun fact, for every pound you gain in front, your spine has to work harder to keep you upright. It's like carrying a backpack all day, except you can't take it off. But you're doing it, mama, you're a rock star. Posture shifts. Speaking of posture, let's get into how your stance changes. As your belly grows, your shoulders might round forward, and your head might poke out a bit. Think of it as the pregnant hunch. It's not your fault, it's physics. But this shifts pressure onto your upper back and neck, too. Ever feel that ache between your shoulder blades? That's your body adapting to the new you. Your core muscles, those deep abdominal ones, also take a hit. They're stretched out to make room for baby, so they can't support your spine as well as they used to. It's like losing your internal corset. But don't despair, this is temporary, and we can work around it. Muscle fatigue and tension. Lastly, let's talk muscles. Your back muscles are in overdrive, compensating for all these changes. They're like the loyal friends who never say no until they're exhausted. That's when you feel stiffness, spasms, or that dull ache that just won't quit. And if you're sitting a lot, hello, Netflix marathons, those muscles tighten even more. So, what do you think? Does this sound familiar? Maybe you've noticed one of these more than the others. Drop a comment below and let me know, what's your biggest back pain trigger right now? I'm reading every single one, because your story matters to me. This might sound like a lot, but here's the truth, your body is a masterpiece. It's shifting, stretching, and growing life. Back pain is just a signal it's working hard, not a sign you're broken. And now that we know the why, we can tackle the how. Ready to feel better? Let's move into some relief strategies that I swear by, both as a doctor and as your cheerleader. Alright, here's where the magic happens. I'm not just going to tell you to rest, because let's be honest, that's easier said than done when you're growing a human. These are practical, safe moves you can do at home, no fancy equipment needed. I've used these with patients for years, and they're game changers. Let's get your body moving and that pain melting away. Pelvic tilts, your back's best friend. First up, pelvic tilts. These are like a gentle hug for your lower back. Here's how to do them. Lie on your back with knees bent and feet flat on the floor. If lying flat feels off, totally normal later in pregnancy, prop yourself up with pillows or do this against a wall. Tighten your belly muscles like you're pulling your belly button toward your spine. Tilt your pelvis up slightly, flattening your lower back against the ground. Hold for 5 seconds, then relax. Repeat 10 to 15 times, nice and slow. Why does this work? It strengthens your core and takes pressure off your spine. I've had patients tell me they feel relief after just one session. Try it right now, pause this video if you need to, and tell me how it feels in the comments. Cat-cow stretch, wake up your spine. Next, let's flow into the cat-cow stretch. This one's a yoga classic, and it's perfect for pregnancy. Get on all fours, hands under shoulders, knees under hips. Use a mat if your knees need cushioning. Inhale, arch your back, lift your head, and let your belly drop gently, that's the cow. Exhale, round your back, tuck your chin, and pull your belly in, hello, cat. Flow between these for 8 to 10 breaths. This loosens up your spine and eases that upper back tension. It's like giving your back a mini massage. Have you tried yoga before? What's your go-to stretch? Share below, I'm curious. Wall squats, build strength safely. Now, let's strengthen those legs and glutes, they support your back, too. Stand with your back against a wall, feet shoulder width apart and a foot or two out. Slide down into a squat, knees at 90 degrees if comfy, or less if not. Hold for 5 to 10 seconds, then slide back up. Do 10 reps. This builds power without straining your belly. You're a warrior, and this proves it. Seated side stretch, release the tension. Finally, a seated stretch for that tight upper back. Sit cross-legged or on a chair, spine tall. Raise one arm overhead, lean gently to the opposite side, feeling the stretch along your ribs. Hold for 20 seconds, switch sides, repeat 3 times. This opens up your side body and feels so good. Try it with me now, breathe deep and let that tension go. These moves are your toolkit. Start small, 5 minutes a day, and build up. You're not just relieving pain, you're reclaiming your strength. How does that sound? Ready to give it a shot? Alright, we've got the moves down, now let's talk lifestyle. These are the little shifts that add up to big relief. I've seen patients transform their days with these, and I know you can, too. Posture power. First, posture. Stand tall like you're a queen, shoulders back, chin up, imaginary crown on. When sitting, use a small pillow behind your lower back for support. Avoid slumping, your spine will thank you. Sleep smart. Sleep is sacred, right? Use a pillow between your knees if you're a side sleeper, it keeps your hips aligned. A body pillow is a pregnant mama's bestie. Shoes matter. Ditch the heels, sorry, fashionistas, and opt for supportive flats. Your feet carry you, so treat them right. Stay active. Keep moving, gentle walks, swimming, whatever feels good. Motion is lotion for your joints. What's your favorite way to stay active? Tell me below. These tweaks are your armor. You're not just surviving, you're thriving. Let's keep that momentum going. Wow, we've covered a lot, haven't we? I'm so proud of you for sticking with me. You're not just a mama-to-be, you're a force of nature, taking charge of your body and your life. Back pain doesn't stand a chance against you. Here's your homework, pick one move or tweak from today and try it this week. Then come back here and tell me how it went. Did it ease the ache? Boost your mood? I want to hear it all. And let me know where you're watching from, your city or country, because we're building a global tribe of strong, unstoppable women. If this resonated with you, hit that like button, subscribe, and share it with a friend who needs this. Let's spread the love and the relief. I'll see you in the comments. Keep shining, mama.